Hello guys, welcome back to the D&N Medical series. I'm Damar and I'm here with a brand new video this week. Now in today's video we're going to look on the risks of developing cervical cancer. And cervical cancer is one of the most common cancers in females secondary to breast cancer and is a leading cause of mortality in females. So if you're new here, don't forget to subscribe to our YouTube channel and also to follow our Instagram page. That's D&N_Medical_series. So there are many risks of developing cervical cancer, and it is mainly associated with HPV, which is a virus, human papilloma virus. And the risk factors include persistent HPV infection. So if you're exposed to HPV, usually it takes 10 years for you to develop cervical cancer. If you have multiple sexual partners, there is an increased risk of you getting the HPV infection. And because of this, the more sex partner that you have is the more chance you have of getting the virus. Also, smoking can increase your risk because it affects the cervix and it can cause changes in your cervix, would put you at risk of getting cervical cancer. If you're immunosuppressed, then your body cannot fight the HPV in case of infection, and therefore you are more at risk of developing cervical cancer. If you're exposed to a drug called DES when your mom was pregnant, then the daughters of the mom will be at risk of developing cervical cancers as well. Also, if you have a family history, especially in a first-degree relative, so like your mom, right, or your grandmother or your daughter, then there's an increased risk of you developing cervical cancer. Lastly, people who are on oral contraceptive pill are at risk of developing cervical cancer, and this is because when you're using OCPs, you're more than likely having unprotected sex, would increase your risk of getting the HPV infection. Please remember though, there are vaccines out there against HPV, and these vaccines can decrease your risk of developing cervical cancer by over 90%. Alright, so that's it for this video. See you in the next one. Goodbye.